Prediabetes means that your blood glucose or blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes, which is the most common form of diabetes. Prediabetes affects so many Americans. 84 million Americans have prediabetes. In South Dakota alone, it's over 200,000 people, adults with prediabetes. So we're talking about 1 out of 3 adults have this condition. People what put you at risk for diabetes are certain factors. Some of them you can't change, such as your age, your race or ethnicity, African American, Asian American, Native American, Hawaiian and Alaskan Pacific natives are more likely to get prediabetes. But there's also things such as being overweight and not regularly getting enough physical activity. An online risk test, you can go to doihaveprediabetes.com, or if you're in South Dakota, you can go to a website called undothe-risk.com. And there's a simple online test. It only takes about 60 seconds to complete. You'll answer some health questions. It's anonymous, it's free. You can just find out, and if the test does show that you're at risk, you can go to your healthcare provider and they can do a simple blood test. And the blood test is either a fasting blood glucose, an A1C test, which is a measure of your blood glucose over a period of time, or an oral glucose tolerance test. So that can confirm whether you, in fact, do have it or not. And if you do find out you have it, there's steps that you can do to prevent it or delay as long as possible that diagnosis of type 2 diabetes. So the National Diabetes Prevention Program, Lifestyle Change Program, is a 1-year-long structured lifestyle change program. This is where a group of participants gather together. You do have to have a certain criteria. You have to have prediabetes or at high risk for diabetes to be in this group. And it's taught or facilitated by a trained lifestyle coach, and this coach walks people through simple things that people can be doing to take better care of themselves, eating well, getting regular physical activity, managing stress, and it's done in a group facilitation. So what strategies may work for one person may not work for another, so it's really using the group support to go through and try to help people lose just a modest amount of weight loss and to make some really lifestyle changes in the way that they're living. Go through a structured lifestyle change program. They can reduce the risk of diabetes by 58%, for type 2 diabetes by 58%, which is really incredible. And it can really impact and change lives. So prediabetes can be reversed with simple lifestyle changes. And those healthy lifestyle changes would include, managing and eating a healthier diet and making sure that you're getting regular physical activity. We're talking about a modest amount. It's about 150 minutes a week. That's about 30 minutes 5 times on most days of the week. And we're talking about brisk walking, making sure that you're doing something that you enjoy doing. It could be dancing, it could be walking, it could be gardening, anything that's going to get your heart rate just a little bit up.